Welcome everyone. This is Lack of Access 101, How Public Libraries Combat Disparities and Bridge the Digital Divide. With that, I would like to introduce our speaker today. So thank you for joining us today. I am Martha Meacham, the Project Director for the Network of the National Library of Medicine, or NNLM. I have the honor of working with today's speaker as she put together this training and the accompanying materials. So I'm pleased to introduce our speaker today, Carlette Dennis. Carlette Dennis currently serves as a National Library of Medicine Associate Fellow. She worked for 10 years at the New Orleans Public Library. During that time, she received her MLIS from Louisiana State University. Carlette has coordinated adult-based public programs, provided reference services to the public, and oversaw collection maintenance at her library locations. Carlette was also an active member of the Adult Programming Team, Strategic Planning Committee, and Virtual Reference Team for her library system. As part of her spring project during her fellowship, Carlette expressed interest in working with the NNLM as it relates to their Bridging the Digital Divide initiative. It is her hope that today's class will help those in the audience with their daily interactions with the public that they serve. And now I turn it over to Carlette. Thank you.
Good afternoon, everyone. I want to thank you all for coming, and I want to send a special thank you to those who are spending their lunchtime with us. As an associate fellow, when conducting programs throughout the year, I had the honor of creating this webinar for training with NNLM. Even though all are welcome, this training is geared towards new library workers and librarians working at public libraries. I wanted to provide this training to new staff because when I started at the library, there was no training to teach you how to interact with the patrons. So it was a trial by error situation. I started as a library page. My background was in a completely different field. So I had no knowledge of the inner workings of the library. It was only after years of creating adult-related public programs that I decided to go to library school. And of course, during that time, I worked at the circulation, reference, and children's desk daily. So I've had several opportunities to assist the public with finding information. After some time, you gain regular patrons, and those patrons cover multiple demographics, including older adults. After this training, participants will leave with an introduction to the digital divide with a better understanding of their role as advocates for access to health resources. We'll leave knowing how to assist non-technology savvy patrons with finding health resources in person and online. And we'll be introduced to what some other public libraries are doing to address the lack of access to internet services. What is the digital divide? The definition of the NLM's website states that the digital divide is the gap between those who have...
They send away for these.
Go ahead, I got it.
The digital divide is the gap between those who have affordable access, skills, and support to effectively engage online and those who do not. As technology consistently evolves, the digital divide prevents equal participation and opportunity in all parts of life, disproportionately affecting people of color, indigenous peoples, households with low incomes, people with disabilities, people in rural areas, and older adults. While conducting the literature review portion of this project, I came across a few terms that I want to share that gave me a better understanding of the digital divide. Those terms and their full definitions are available on the NNLM Bridging the Digital Divide Initiative webpage. If you all can hear, y'all might hear like the grass being cut on my end, so I'm sorry about that ahead of time. They should almost be finished. The digital divide and digital inclusion. When I think of the term, I remember how at the start of the pandemic, city officials in my home of New Orleans announced that they would be providing Wi-Fi access throughout the city for students since the schools were closed and attempting to go virtual. My coworkers and I were happy that free Wi-Fi was going to be available. However, we knew a lot of kids did not have their own computers because they would come to the library. And at that point, the libraries were closed. So even though internet services were being offered, according to the definition of digital inclusion, these students still lacked the devices needed to access the internet. This leads us to the next term of digital equity. Low-income individuals and families are the main consumers of public libraries, and having the ability to have access to free Wi-Fi is great if you have devices to connect. The public schools in New Orleans answered this problem by providing laptops to their students who did not have them at home during the height of the pandemic. Also, private organizations such as cell phone companies gave away laptops to low-income students. Speaking of cell phone companies and internet providers, the term digital redlining was new to me as I was unaware of the discrimination by these providers. However, for those living in rural areas, it's harder to have access to internet services. In certain parts of Louisiana, internet services are extremely hard or non-existent to connect. I know I had a internet provider for a long time that would go in and out, and it really affected me being able to do anything internet-wise. So when an opportunity came about for me to work from home, I was a little hesitant because I didn't know if I was actually going to have internet or if it was going to be off for a long period of time. And so different resources and availability to help with connecting is really important. Another term that I was unaware of was broadband adoption. However, I will speak more about this later with how public libraries around the country are answering this call by providing daily access to the internet. And the last term, which is very popular in the library, is digital literacy. When helping older patrons, some would say I'm digitally illiterate. And it always broke my heart to hear that because I wanted them to know that they can learn how to use a computer and explore the internet safely. With this in mind, let's learn a little bit more about how we can provide that level of trust to our patrons. Since this webinar is for non-seasoned library employees, I wanted to go with a plain language definition of what a reference interview is. According to Wikipedia, a reference interview is a conversation between a librarian and a library user, usually at a reference desk, in which the librarian responds to the user's initial explanation of his or her information need by first attempting to clarify that need and then by directing the user to the appropriate information resource. Now that we've had an introduction to what is a digital divide and how it affects our community, let's listen to this reenactment with both individuals performed by myself. We are meeting Mary Young, a patron of XY Library. Mary is 74, so she would be in the older adult demographic. She is retired, married, grandmother of 6. Mary has some health problems, and she was recently gifted a tablet. Let's listen to her interaction with the librarian.
Good morning. How can I help you today? Yes, dear. You can help me. I need assistance on the computer. Oh, okay. What are you looking to do today? Well, I tried to call for a doctor's appointment, but was told that the only available was a virtual appointment. I don't know how to do that, and I don't have anyone to help me. The nurse suggested the library. Okay, I can help you with that. When is the appointment? At 1:30 p.m. Today? Yes. Do you know what website you have to log into? Um, it's okay. Did the nurse give you any paperwork or login information? Yes. Give me a second. Here it is. Okay, I see. Well, I'm gonna get you signed into one of our computers. You will be ready to go for your appointment in 10 minutes. Thank you. Oh, it's no problem. Right this way.
From what we just heard, Mary Young came in with all of her information, and the librarian was able to help her log into a library computer. This was a good outcome for both the patron and the staff person since they were both left with their goals completed and done correctly. However, sometimes that's not the case, especially when related to healthcare questions. I found that the following information has assisted with offering consistency to all patrons. The do's and don'ts of a health reference interview. Do listen and pay attention. Don't talk over the patron. Do be discreet with the patron's private information. 9 times out of 10, you're dealing with someone's personal information, and they may not be comfortable sharing so much with a stranger. Don't leave information where others can view. Do be compassionate. Don't accept unnecessary details. If I had $1 for every time a patron tried to give me their social security number, even though what I was assisting them with did not call for that information, I would probably be really rich right now. Do provide a private space if possible. For some libraries, providing a private space may not be an option. I would suggest explaining all the quiet space options that can be provided at your location. One of the branches that I worked at was a schoolhouse style setup, so privacy was non-existent. We would allow the patrons to sit in the stairwell that led to a staff loft area so they can conduct their private calls. We also had picnic tables outside for them to use. Don't give medical advice. Now, people will ask for suggestions. The safest thing you can do is to rely on the information they requested and try not to get too personal with your own information. Sometimes that's easier said than done. And finally, do check in to see if additional assistance is needed. With this information in mind, let's listen to this reenactment with both individuals performed by myself. We join our librarian again as she receives a phone call from Mrs. Mary Young the next day. Let's listen to see how the librarian handles an over-the-phone reference interview. XY Library, librarian speaking, how can I help you? Yes, dear. Were you the one who helped me yesterday with my doctor's appointment? Oh, yes, Mrs. Mary Young? Yes, I have a question. My daughter brought me a tablet for Mother's Day, and I wanted to use it to look up this medicine that my doctor put me on. Can you help me with that? Yes, I can help you with that. Can you tell me what kind of tablet it is? A Kindle Fire is what the box says. Okay, and did your daughter set it up for you? Are you connected to the internet? Yes, she did it when she was here last week, and I just pressed the square that says internet. Okay, great. I'm going to put you on a hold for one moment while I get a tablet to follow along with you. Okay. I'm back. Now, can you tell me what you see on the screen after you press the square? It says Amazon Silk, history, shopping, news, all with these little pictures above them. Perfect. So at the top of the page, do you see a bar that says search or type web address? Yes, I see it. Okay, I want you to tap it and let me know if a keyboard pops up. Yes, the keyboard popped up. Great. Now I want you to type the words Medline Plus. The tablet may finish typing the words as you are typing. Yes, it did. Now, you should see an orange key on your keyboard. It looks like a circle with a greater than symbol in it. I want you to press it. Okay, I pressed it. Now, what do you see? I see the words medlineplus.gov, a bigger version of the words Medline Plus, and it says I can find information on health conditions, etc. Perfect. Now click the bigger Medline Plus. Did it take you to the website? You should see the words, Welcome to Medline Plus. Yes, I see it. Okay. Do you see where it says search? Yes, I just pressed it, and now it says search Medline Plus. Okay, now your keyboard should have popped up when you pressed the search. It did. Okay, now type in the name of the medication. The name may start showing up before you finish typing. It did, and I pressed it. And now a whole list of things has come up. Thank you. I clicked one and I'm going to read it. I will call you back if I have any other questions. You're very welcome and have a good day. We just heard a detailed phone reference interview. It may have seemed easier to just ask the patron to come into the library for assistance, but transportation may be an issue for patrons. I find that being open about what I can assist with is always helpful to myself and the patron. As we heard, the librarian asked for a moment to gather materials that she would need to assist the patron over the phone. Sometimes that can be a device, reference materials, or a coworker. The tips shown on this slide have helped myself and others when assisting patrons in person, over the phone, and online. One is using the same terminology as the patron. Sometimes this is difficult since, as a new employee, you're learning library terminology for your job. However, the patron may not know what you mean when you use the term patron. They may be used to the word user, customer, or consumer. In the library world, we call this using plain language. I'm an advocate for these. Being from New Orleans, we tend to have a different way of saying things. And I'm sure you heard me throughout this presentation so far pronouncing the word library as library. Another is creating a paper document of the fields required on an online application. A coworker of mine did this for food stamp applications. We had a lot of patrons coming in asking for help with this, and we found that having this document allowed the patrons to gather their information before heading to the computer, making the process smoother for us and them. I hope that these tips will be helpful to you when working with patrons that may need more hands-on assistance than others with technology. Now let's talk about different ways public libraries are currently helping to provide access to public health resources. This slide showcases how public libraries assist the public health field by providing access to health resources. This is done through programming and partnerships with health organizations such as the NNLM, city and state public health departments, and local health organizations. Additionally, public libraries are providing access to and use of public computers, the loaning of laptops, Wi-Fi hotspots, and tablets, both for use within the library and at home. Some libraries have been able to house telehealth booths within them to provide convenient and secure locations for people to communicate with healthcare providers. I'm not going to read the full slide, but a number of these services I have used or use myself as a library worker and user. For example, I called the local clinic to inquire if they would partner with the library and provide free blood pressure testing. They referred me to the appropriate person within their organization, and it turned out that they also had the ability to provide free glucose and cholesterol testing as well. As a library user, I've gotten my flu shot provided every flu season because of a partnership that was established with Walgreens and my library system. They provided this service at several of the library branches within the system. Some other events that I've had created that deal with health and technology related issues include the Digital Life Spring series, where I taught senior citizens for 5 years different databases, websites, and software applications. These included Microsoft Word, Newsbank Database, Foundation Center for Grants, Ancestry.com, the Library Edition, and Scratch Programming Language, just to name a few. I also partnered with different individuals and organizations, including LSU Ag Center, which provided a 6-week nutrition workshop focused on healthful nutritional practices. These 2 programs allowed me to be able to give our patrons just a variety of different opportunities and advantages. Having the ability to create these programs for the older adults in the adult demographic was something that I was very passionate about. I'm still passionate about it, and I feel that older adults need the opportunity to be able to go into their library and know that not everything is just for the kids or the parents. I've had several opportunities for patrons to tell me what they wanted from their library, including certain programs and services they wanted to see available. Speaking to the community allowed several programs to be created, including fitness dance classes led by a former Saints football team cheerleader and a weekly Medicaid sign-up assistance booth. These in-person programs have touched on health and digital literacy, but I'm not the only library worker doing this kind of work. The New Orleans Public Library in New Orleans, Louisiana, and Springfield Public Library in Springfield, Massachusetts are on opposite sides of the country. Still, they both are doing their parts to combat the digital divide. NOPL has a take-home a tablet program allowing patrons to borrow a Samsung A7 Lite tablet with an unlimited data plan from T-Mobile for 6 months. They can also be used as mobile hotspots, a Wi-Fi access point for up to 10 other devices within the home. As a library patron myself, I have borrowed this device for its hotspot capability. Springfield has both a borrow a Chromebook and hotspot program. Patrons can check out a Chromebook, a small laptop with software by Google that allows access to an internet browser via a Wi-Fi connection. The Chromebook has speakers and a camera that can be used for pictures or video, which is perfect for telehealth visits. If patrons don't have internet access at home, they can check out a mobile hotspot with the Chromebook. A hotspot is a small portable device that connects to Wi-Fi from a computer, tablet, smartphone, or an internet connecting device. Both items can be checked out for 2 weeks. These programs help to address the digital equity and inclusion issues of their communities. In addition to addressing those issues, public libraries are providing resources to address digital literacy. For example, the Detroit Public Library offers Library for the Blind and Physically Handicapped at one of its branches. It offers services, materials, and events to anyone with a visual or physical handicap or a reading disability. They provide accommodations by request for physical access, communications, or other needs to ensure services, activities, and programs are available to people with disabilities. On the other side of the country, Seattle Public Library offers Tech Connect, a free virtual tech assistance program for state residents via chat, email, or phone. Assistance is provided in English, Spanish, Vietnamese, and 5 other languages. This information is available under the Technology for Beginners services for older adults. These are just some amazing programs, services, and resources that public libraries provide. Please contact any of the libraries mentioned to learn more about what they're doing, especially if you want to set up a similar service at your library system. As an additional part of my fellowship, I got an opportunity as a part of my spring practicum to visit a health science library, and I chose the University of Washington in Seattle, which is home to Region 5 of the NNLM. Shout out to Region 5. One of my requests was to meet one of their partner libraries. And they went above and beyond, and I was able to meet 3. So in addition to touring the Seattle Public Library's Central Library location with the older adult program manager, I also got to speak with the individual who runs their Library Equal Access program in lab. That lab focuses on assistive technology, including Braille display and a software called Zoom Tech that has screen enlarging software. And this room was just, it was just amazing to see that they actually had a separate place so that individuals could come and get assistance and feel like they were being helped, but they were also being heard. So I really appreciated that. And I also got to meet another partner library, the Snow Isle Library, and I got to speak with their director of community libraries and their East District manager. They spoke about their outreach services that they provide to 23 counties that they serve within Marysville, Washington. That experience was really, really nice, just being able to talk about different programming ideas and different ways that they're reaching out to community members, especially their older members, because a lot of them are homebound, and just how they provide library mobile services to just be in person with them was really inspiring. And also I spoke with an adult services employee of Springfield Public Library to learn more about the collection equity and tech equity awards that Springfield received from the NNLM. This was just a little part of my itinerary during my visit with Region 5, but I like to quote my former manager, Marianne. She always said that when you visit a place, make sure you go and you visit their public libraries. So if you're going on a trip, stop by a public library and just see what they're doing. Additionally, just as you are attending this training, this slide includes some training resources for those staff who want to advance their tech skills. I wish that the tech skills checklist would have been available to myself and coworkers at the beginning of my career, but I do think it's very handy to just like assess yourself and just to make sure that you may learn something you didn't know, or you might want to take on an additional skill, and that may lead you to possibly doing another training or taking a course. So with that said, I would like to thank you all for attending today. I hope that this training was beneficial and that you leave learning something new. I would like to send a special thank you to my project sponsor, Martha Meacham, Rebecca Brown of NTO, Marie Collins, my mentor during the fellowship, Cathal Dunn, the fellowship coordinator, and the current associate fellows. Since my fellowship is ending in June, if you would like to speak about adult services or reach out about opportunities, please connect with me on LinkedIn. Also, I will be at the MLA conference next week. So if you're attending, please stop by booth 623 on Thursday at 1 o'clock and say hello. A link to the slides, the recording, and the additional handouts will be sent out to everyone via email within 30 days. Thank you all. And if anyone has any questions, you can come off of mute or you can send them via chat. And I just hope you have a good rest of the day. Thank you.
Thank you, Carlette. Please feel free to ask any questions or any comments that you have.
I actually have a question, if I may. Thank you very much for this presentation. This was amazing. It's great to see that there is so much work around the country, and particularly with your case study from New Orleans. My question is going directed to the development of digital literacy skills for individuals, for example, to enhance their health communication skills, more specifically to decipher stuff like clinical laboratory results or patient communication with health systems through electronic health portals or patient portals. Thank you.
So with that, I would say one of the things that I have tried to do is to look at different resources that were available through the NIH, the NLM, the NNLM, just seeing what resources that they have, only because at the start of my fellowship, I really did not have a background in health sciences. I really came into this really wanting to learn more so that I could take those resources back to my community to help them, especially with everything happening with the pandemic. I was getting a whole bunch of questions that I either didn't have the answer to or had to do some really intense research. So those were my resources, the NIH, the NNLM, and the NLM. Also, there were some trainings that were available through the NNLM that my library system actually made available to the staff. And it was like a series, like a good maybe 7 or 8 courses that our training coordinator put together, because eventually over time we did get a training coordinator that provided those resources to us. And so they combined those lessons for us to be able to easily access. So that really helped me with getting some needed training around health services. I hope that answered the question.
All right. Well, please reach out to Carlette or myself or anyone at the NNLM if you have any questions, comments, ideas, or would like to learn more. I will thank Carlette again for such a wonderful presentation. Thank you all for attending, and I hope you have a wonderful rest of your afternoon.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.